Jaundice is evident when your total bilirubin count is more than 3 milligrams per deciliter. So that is like when you involve the lab values, the definition is it is more than 3 grams per deciliter. And in general definition, it is yellowish discoloration of skin. Jaundice can be due to two types. Like when we do the bilirubin test, like liver function test, there are two components of bilirubin. One is direct bilirubin and one is indirect bilirubin. Increase in any of these, direct or indirect, can lead to manifestation of jaundice. So in indirect bilirubin, like the unconjugated bilirubin, where if it rises, then we think of causes which is causing hemolysis of blood cells, because hemolysis of blood cells will lead to increase in bilirubin. There are other genetic disorders which will lead to indirect bilirubin increase, like Gilbert's and Crigler-Najjar. These are some syndromes, genetic syndromes, because of which indirect bilirubin might increase and cause jaundice. Whereas the direct jaundice, like direct bilirubin increase, is more common what we see. It can be of two types. One is obstructive and other is non-obstructive. Like bilirubin metabolism, you have to understand for that in short. Bilirubin metabolizes and like bile pigment secretion is a component in this process. So if the bile secretion which takes place from the gallbladder, it is obstructed, then there will be jaundice. That is obstructive jaundice. Like the bile pigment is unable to pass from gallbladder to the ducts. And other is non-obstructive jaundice, where the infective components might be the cause, where the liver itself is damaged, the liver architecture is damaged. Such causes are your most common are your viral hepatitis, hepatitis A, hepatitis E, hepatitis B, and C. Then there can be toxins which can lead to your jaundice. Some unknowingly patient might take more NSAIDs like painkillers, which may lead to your jaundice. And there are other causes like autoimmune causes where the body produces antibody against itself, against the liver, that will cause to jaundice. And then there are causes like gallstones and all obstructive causes which will lead to your jaundice. The most common symptom the patient will like come with is the symptoms. First, you have to understand symptoms are those things which the patient will tell, and signs are the physician will find out. They are signs. So, symptoms, the patient usually complain of yellowish discoloration of eyes, body, high colored urine, like yellowish, dark yellow urine, skin like itching. These are the symptoms usually the patient come with, because the initial symptoms like decreased in appetite, nausea, weakness, they are ignored. And when there is yellowish discoloration, which is the most common symptom, then they come with that. Signs, obviously, we find out the yellowish discoloration of sclera. Sclera is a part of your eye, and yellowish discoloration of that is like manifestation, a very important sign of jaundice. And other, there can be rashes, and the underlying disease might not only cause jaundice. There might be some other clinical manifestation as well, like the organs might be enlarged, so we will be able to palpate the liver when we will do the abdominal examination. Then some lymph node might be enlarged, or some other rashes, or like skin texture changes. These can be the signs which a physician will look for. Most importantly is the icteric, like yellowish discoloration of the eye sclera. That is the most important sign. We treat the cause actually. First, we have to find out the cause. Liver function test is a very important test. According to that test, there are certain enzymes. Now, based on the enzymes, the differential diagnosis are based, and if the ultrasonography is suggestive of certain features like gallstone, that is the cause, we treat the cause, we operate it at the right time. If the infective parameters are the cause, like hepatitis A, E, or B, or C, we treat that with antivirals. Hepatitis E and E usually do not require any antivirals, but B and C does require antiviral treatment. If it is due to toxin, then we just slowly remove the toxin, and we do give a supportive treatment rather than an active treatment. We monitor, and the parameters are like frequently checked and monitored and treated accordingly. Hepatitis A and E are usually due to fecal-oral route, like outside food and outside water. They are responsible. So we tell not to get exposure of outside food and water so frequently. And diet, we have to give like normal. Initially, the patient will have nausea and vomiting, so we do give a bland diet initially. Then slowly a salt restricted fat free diet is preferred if the patient develops jaundice due to gallstone. And if it is a normal hepatitis A and E, we can give normal diet as well. And certain hepatitis like B and C may cause chronic liver disease, which may manifest as jaundice. That time, the diet is protein restricted, like do not give high protein and salt restricted, because there are other complications too, along with jaundice in hepatitis B and C sometimes when there is a decompensated liver disease. So diet changes according to the cause. So if it is a gallstone cause, we do give a fat restricted diet. And if it is like due to a pancreatic carcinoma, then we give a fat restricted diet. If it is a normal hepatitis E and A, then we give a normal diet. So it is according to the cause. It is something which will vary. Like if it is because of a gallstone, the operation will be done whenever the patient is fit to get operated. And usually the jaundice resolves very fast. If it is due to pancreatic duct obstruction, which will lead to like some stones sometimes not only get obstructed in the bile duct, but sometimes away from the bile duct, which we called as common bile duct. There we have to place a stent, and then the flow of the bile is again like we are able to establish the flow once again, and then gradually the jaundice decreases over 2 to 3 days, 4 days, maybe 1 week. But sometimes when the patient has like hepatitis A and E, it may take a little bit longer time. So it may vary from 7 days to 10 days also, because patient might come with a bilirubin of 10, and jaundice will be there till it like if it is more than 3, then we will have jaundice. So from 10 to like less than 3 does take time. So around 7 to 10 days might be required, and in some cases even more. But like the common causes of jaundice, we need not panic. Like hepatitis A and E, it is a self-resolving disease, so we need not panic. Just wait and monitor the vitals, and jaundice will subside in a week or two. Jaundice is due to hepatitis B and C, then it is communicable via sexual route or blood. If it is due to A and E, now that is feco-oral route. Now, feco-oral route means feco means feces, and the stools, and oral means what we eat. So like proper washing of hands, like at micro level, very small, like nano level and micro level, the stools might be there in the fingers and fingertips. So that gets transferred in the water or the foodstuffs which we are handling, and that's how the other person might get the infection inside himself or herself. So that is feco-oral route, like the feces from hand at micro or nano level, which we cannot see, gets transferred via food to somebody else. So that is how it is transmitted in hepatitis and A and E. In B and C is more of via blood and via fluids, body fluids. So yes, those are transmit. Like it can be transferred from person to person. But other causes of jaundice, like some hemolytic blood cause or some gallstone or some toxin, they are not transferred from man or the person who has jaundice will not be able to pass on to other person. So if it is infective, yes, the person can pass. But if it is a non-infective cause, then usually it does not pass. Jaundice is actually a sign of an underlying disease. So it will cause some other manifestation, other complication as well. Now, if the jaundice is because of a chronic liver disease, where the liver architecture is already distorted, that time if a person manifests jaundice, that means it is a decompensated state. Like it has gone beyond like the normal body capacity to handle. Then there might be some other like complications as well, like fluid collection might take place in the abdomen, ascites may take place, swelling of lower like limbs and the face can take place, edema. But these are seen in underlying chronic liver disease, which gets decompensated sometimes and manifest as jaundice. There, the complication might take place. Or if it is a toxic liver injury, where the liver is been hit by some toxins or drugs, and liver has got damaged, then the patient might even go to shock, like the blood pressure might fall, and like patients uh, becomes drowsy. So these can be the other complications of the underlying disease, which is also manifesting jaundice. Jaundice, as such, directly won't cause the complications, but the jaundice manifests only when there is some underlying cause also. So that underlying cause will cause the complication. In certain cases, yes, because some jaundice like hepatitis B and C, which causes jaundice, they can be prevented from like not like C is not yet developed, but B can definitely prevented by vaccine. So hepatitis B vaccine is given at childhood itself, and that in future will prevent the person from acquiring the disease.